Hi, my name is John Gibbons and I'm an osteopath and author and a lecturer for the Body Master Method. And in this video, I'm going to demonstrate how to manipulate the C7 on T1 vertebra. It's known as the cervical dorsal junction or the cervical thoracic junction. If we bring the head forward and you notice there is a lack of space, then it could well be the C7 is fixated closed on T1. You could also might find that the end range of rotation is limited due to the lack of motion at the C7 T1. The nerve is the C8 nerve with T1 below, and then that will form the ulnar nerve, which might give you altered sensations to the area of the little finger. Now, to manipulate it, I would suggest we leave a t-shirt on because the arms will come under the armpit. And then the way I do it, my hands will be onto his forearm, and I'll say to my patient, interlock your fingers behind your neck, please. So he interlocks, and then from here I will then bring his elbows forward to protect his shoulder. The patient is also sitting back to me as well, so I don't have to reach towards my patient. Now, from this position, I'm going to place my upper body, as in my upper chest, over his upper back. And then from here, I'm going to, left leg is back, the right leg is forward. So I'm going to rock my patient forward and bring them back. So I'm going to rock my patient forward and bring them back. There's the tension point. So from here, the thrust would be a continuation coming back, but don't thrust too much with the arms. Try to apply the pressure coming through the chest. Now, so we'll do a little trial here, okay? So take a small breath in, and then as he breathes out, I'm going to go into a lock, and then there will be the lock, and then the thrust will be from there. So let's go for it for real now. Take a breath, and as he breathes out, we lock, and we thrust, and it cavitated very nicely on C7 and T1. Relax, please. Now, you can reassess by asking the patient to rotate as far as they comfortably can. You can also flex to see if a space has opened. But we're going to focus on the mid to lower level around the T6, T7, T8 region. When I do the manipulation in the sit-in position, I tend to use a towel and I tend to roll it so it's very firm. And sometimes the key or the art of manipulation for this area is making sure that the towel is as firm as you can get it. Let's say we want to manipulate T6, 7. So find the inferior angle. I would have already assessed this area and I would have said that the facet joint of T6, 7 is relatively fixated. It does not matter if it's on the left or the right for this manipulation because it's a simple separation of the two vertebrae. Now, what we're going to do is apply the towel onto that area of T7. The patient is sitting back to me rather than me going to my patient. From this position, I'm going to bring the right arm of the patient, where is it, under the left arm, hold on the back of his shoulder. So I would normally pull to tension. This hand onto the elbow, this hand onto the head, and I'm going to flex my patient down to the level, not past it. So until I feel tension to the towel, I can fine tune from here. This hand now onto the elbow, my left leg is back, my right leg is forward, and I literally am going to pull and lock in this position here. So it's literally my hands pull as I push with my sternum, so there's almost like an AP-PA thrust or glide or lock technique here. Now, once I'm happy and the patient's happy, I'll say to my patient, take a small breath in, please. And as he breathes out, I'll lock and I'll thrust. Okay? And hopefully we would be in a nice little release to that area. If I wanted to show you one level below, let's say that was T6, 7. If I go to say T8, 9 or 1 or that area, hold there, head forward, slump down to the level, so a little bit more flexion, take a small breath. And as he breathes out, lock, and then we have a nice release to that area. So there we have manipulation to the thoracic spine. I would call this technique a thoracic thrust using a small hand towel.